If your lipoprotein A levels are elevated, this means that you have a genetic form of high cholesterol. Unfortunately, lipoprotein A is a cholesterol that's given by genes and isn't really determined by diet and exercise. So it's very possible to have a very healthy lifestyle, to eat well, to exercise, and still have this high level because it was determined by your genetic makeup. However, there's still some things that we should do to help protect you from heart attack and stroke, which are the things that having elevated lipoprotein A level can do. The first is that we should make sure that your other cholesterol levels, such as your LDL and your ApoB, are as low as possible. We can optimize this with healthy diet, such as a whole food plant-based diet, and by minimizing your animal protein, especially things like red meats. Fried foods can also raise your cholesterol levels, so we want to keep those as low as possible. It may be appropriate to use medications, but we don't have to jump to them immediately. The second thing would be to get a coronary artery calcium score if you are over 40 years old. This is a special test that can look at your heart and determine if you have cholesterol buildup that could lead to heart disease and possibly stroke. If a plaque is present, that means we must be extra aggressive about lowering your cholesterol levels, considering using things like medication. If you would like to have a coronary artery calcium score done, we can certainly order it for you. Locally, one of the facilities that offers a lipoprotein A level is Wellstar, and they do this for a cash-based price of $99. It's not often offered by insurance or covered by insurance, but well worth the investment to know about your heart health. If you'd like me to order it for you, I'd be happy to. Because lipoprotein A is a genetic test, it's not something we have to keep testing again or following. So once we do it one time, you never have to do this test again. You'll know whether you have high LPA or if you have normal LPA levels. If you have elevated lipoprotein A levels, I don't want you to fret. There's still so much we can do to ensure your heart health remains healthy. This means living the healthiest lifestyle possible with following the whole food plant-based diet and lowering stress levels.